Biotech is what I love personally, and I hope you love it too. So I'm Marek, and I'm the founder of the Innovation Forum, and I also run a consultancy company called Cambridge Squared, based in Cambridge. And I have the pleasure of sharing a panel today with a great group of people. I'll be inviting them to come to the stage, and then they will introduce themselves. So I will start with Samantha Kingdom from Amgen. And give them a round of applause, please. All right. So we're here, guys, to discuss the future of the healthcare industry. How will healthcare look if we transplant ourselves from now 20 years forward? What sort of healthcare will we have? What role will the current industry companies have to play in that world in 20 years from now? I will start with science, right? So what sort of, I mean, let's talk also about what we have now that will shape the future and where we will be in 20 years. So I'll start with science. What scientific fields will be the key drivers of the healthcare industry over the next 20 years, and what new scientific fields will start coming up in 20 years? Okay. Anyone?
I'm happy to start with that. I think as you look to the future, it's not necessarily going to be about one particular scientific field or one particular modality or area that we're investigating. It's very much going to be based on data and big data and our ability to use data to improve healthcare. And I think genetics is also going to play a very big role in that, and so that we can be a lot more targeted in terms of how we develop new breakthrough treatments, and also more targeted in who we give those treatments to. Mm-hmm. And both of those working together, I think, is really going to shape how the healthcare industry moves in the future.
So like patient stratification and so on. Anyone else would like to add anything? Maciej?
Yeah, for sure. So I think I'll certainly agree about the data feature. I think biology basically needs to move from phenomenology to real science, right? So sort of physics type of situation where we have data and we can predict the future state of a particular system. And then, I mean, we are today still in a situation where we are surprised every single day. Whatever data comes our way, we say, we haven't thought about this. So I think we need to, in the next 20 years, I really hope that science will allow us to be a bit more predictive, I think, about biology.
Yeah. Okay, so would you, just on that, Maciej, so I was talking to someone earlier today who said that actually science or biological sciences need to move from hypothesis-driven sciences to patterns-driven sciences. Would you agree? Will that happen? Would anyone like to comment on that? Pattern-driven discovery rather than hypothesis?
Yeah, I mean, I think this is what I sort of mean, that again, we should hopefully move away from, just observing bits of data and trying to make sense out of them. We really need to sort of accumulate enough data, allowing us to study the whole system and basically predict what the future state of the system may be. Like in physics again, we have good examples where, 200 years ago we were surprised with many observations in the world around us. Today we are really good, I think, at predicting what will happen if you, press here and drop there. I think we need really to move into this direction with biology, and probably data and data analysis, the huge amount of data will probably allow us to do that. That's certainly my hope.
Matt, do you want to add anything to that?
Yeah, I think certainly over the next number of years there will be this collision between science and data, and using data to interpret how things are going to play out. But I think what's really important as a biopharma industry as well is that we raise the innovation bar quite significantly, because what we will be faced with is payers and governments that will not be willing to pay just for incremental innovation. So raising the innovation bar for sure, but also working outside of our traditional industry. So working with data companies, working with non-traditional partnerships to help to get a better understanding of the ecosystem of the future. And then, of course, working with patients as well, because delivering a drug is only one thing, but deriving those outcomes in the real-world setting is still much lower than what we should expect.
Yeah, we'll talk about patients. I think that's very important. But I would jump back to data, right? So I think nobody doubts it that data will shape this industry and all of the other industries. Now, would anyone like to comment on the issues that will be the issues with data that we have now that you think would be solved in the future, and how will they be solved? I'll ask Beatriz maybe to comment.
Yeah. Well, just to come one step behind, one step back, in my view, the healthcare in the future will depend on a multitude of sciences that are not only the sciences that we are traditionally discussing.
Yeah, which ones do you think will come up? Yeah, comment on
well,
that.
I would think that you need to put together, of course, the digital sciences, because we are discussing them all the time, and that's taken for granted. But you have the food sciences, you have mathematics, you have physics, you have even, I would say that architecture aspects will impact a lot in health. The health component. I was looking at this picture upstairs for the intelligent city. So everything is there. All the sciences that you need beyond the genomics and the understanding of disease and so on is also the science of the generation of diseases, which is very much beyond the traditional sciences.
And if I may be controversial, if we have many scientists here, what about arts? Do you see arts playing with science in the future, in the healthcare space?
Yes, of course. Yeah. If you think that arts, let's imagine music or art itself, it impacts even the behavior, doesn't it? It can, a kind of a picture of art, of a music or whatever, it can make you sick, it can heal you or at least contribute to change your state of mind. When you have a different state of mind, you might have even a different behavior or predisposition to fight, because your immune system reacts to a lot of this type of factors. So somehow, yes, I think it's a very good point also that art will help. So somehow, I have difficulties on excluding some types of sciences from the full picture that will impact in the healthcare in the future.
So you think like 20 years from now, we go to a doctor and the doctor says, well, okay, sir or madam, here is a ticket to the museum. There is a great exhibition of, old style 20th century art, right? Do you see that happening?
I think it's more likely to be the patient being given a treatment relative that makes sense for their disease, that is going to work because it's been pre-selected and pre-tested in that type of patient, that it's given at the right time, and around that it's not just the treatment that's given, but everything else that falls around the patient that is going to help them improve their health outcomes. And so it could be, maybe it's not a ticket to the theatre or something, but it could be, guidance or encouragement to do the more holistic approach to managing their health as well. So,
yeah, fantastic. That really opens.
Just maybe one comment, two maybe comments. I mean, one thing is that I think today we already see doctors prescribing sleep.
Yeah.
I think that's
we would
basically changing behavior.
Sure.
It may as well be that one day they will prescribe some rest in terms of going to the theater. But maybe also going back a little bit on the design, and just to say something, I was quite amazed to see. Healthcare is obviously only part of the life sciences, and there is, the other part, the synthetic biology, for example. So in some of the conferences around synthetic biology, you see people from Autodesk, you see people from Microsoft attending, because it's all about design. Well, now, the thing that you're designing happens to be new life. Bacteria, the chassis organisms, they sort of need to be designed in some way, and they want to use the principles of engineering, the principles of design to help biology. Now, how the synthetic biology will, again, come relevant when and if and how will become relevant for healthcare industry, I don't know. In 20 years, it may as well, but I just wanted to make the point that it's already happening. May not necessarily be today in healthcare, but in synthetic biology, industrial biotech, it is happening.
So would you say that the healthcare of the future will have, I mean, the system itself will have a strong element of design thinking behind it? Would anyone like to comment on that? Beatriz, no? Is there a need to redesign the healthcare system?
For sure. No, for sure. When
How will it be redesigned in the future?
When we start, I think that attempts are starting to occur, of course, because when you start to see what's happening in terms of, let's say, the personalization, the patient centricity, which is is becoming the paradigm or the basis for the paradigm for healthcare and medicines development and so on, then you will see that systems are not prepared. And when we are talking about healthcare system, we can talk about let's say the medicines, we can talk about the medicines, the medicine practice, and we can talk about the payers and the payments and the support by governments of this for the citizens. And of course that this is going at huge speed in terms of development, rethinking on even the ways of treating, but the systems themselves, they are not being sufficiently agile to adjust into all these proposals. So yes, there will be there is a need for a thinking by now, now, on how to manage it for the future, or it will not be feasible.
Right, so yeah.
Can I just, I think to add to that, because the thing that's staring us in the face right now is affordability for any healthcare system.
Yeah.
And we see this aging population. And the current system, or many systems, are kind of set up on this it breaks and we fix it. So if we think about cardiovascular disease and somebody has a heart attack, you have they're rushed to a hospital, they have state-of-the-art medicine to save that person's life, put a stent in or have other interventions made. That costs an extraordinary amount of money, okay? But state-of-the-art.
And could be solved by design thinking, right?
Well, it's more about preventing it before it happens.
Exactly,
so we need to move to a predict and prevent model. And this is where data is going to be important and drug discovery is going to be important, that we know who is at the highest risk of having heart attack and how do we reduce those risk factors so it doesn't actually happen. And I think
Samantha,
that's where we need to go to.
Yeah, Samantha is absolutely right. If you look at the way healthcare systems have been constructed over the last 50 years, it's for acute care. But more and more, we're dealing with chronic therapies. So there is this rebalancing of the hospital sector, getting patients out into the community, keeping them healthy. And when we know that certain risk factors are going to lead to a certain outcome, we should treat much earlier. A good example is diabetes and cardiovascular disease. Clearly, type 2 diabetes leads to cardiovascular disease. So then treat earlier with the cardiovascular protective product. Makes sense. And these things don't cost any more. So I think we need to think much more in the prevention mode rather than treat when sick.
Yeah, and I think that's where the data piece is going to be really important, or one area is where it's going to be important, because we can start to think about using machine learning to create algorithms to know who is going to be at greatest risk. So you're giving the medicine to the person who's at greatest risk to prevent that event.
Beatriz?
That helps.
At the same time, somehow, and if we are talking about the future and 20 years from now, and after having been exposed, even during this conference, to so many
using a variety of different tools, including food or exercise and so on. This all actually again boils down to how we all work together with all the bacteria that we have in us and around us.
And I think
Samantha?
Just to add to that, the increasing trend we're going to see, if you think about Big Pharma, you challenged where we're going to go to, is collaborating with others, partnering with others that have different capabilities and expertise, but that wrap around that ecosystem and the healthcare ecosystem.
So would
and
you
that's
then go
how we're going to evolve.
Yeah. So I mean, my take on that, and please correct me if I'm wrong, is that pharma will move slightly more towards the consumer market. Would you think that's defensible or not?
I think I was talking to my colleagues before we came in. We'll stay, I think, in terms of where we are expert, okay, and that's in the science and developing new medicines, new modalities that are going to meet an unmet medical need.
Yeah.
Where we also need to get very strong is building partners and collaborations with others in the ecosystem that have expertise that we don't have, but actually add value or enhance the overall health outcome. So I don't think we'll move more to consumer, but we'll work closer with other organizations.
And that's a
I
common
would-
theme. That's a common theme. The more and more connected world, right? That's the industry 4.0, of course, and that will obviously affect healthcare.
Yeah.
Matt, you wanted to add something?
Yeah, I would fully agree with this partnership approach, but also affordability was mentioned earlier on. And the bottom line is that governments will, in the future, will not pay for packs of medicine. They will pay for outcomes. And then we have to rethink our model, again, about how we interact with governments so that we can provide that value proposition and that we can make a value proposition of outcomes and put skin in the game rather than just maybe the traditional selling of medicine. And this means we have to rethink the way we interact with governments, with payers, et cetera, et cetera.
Yes, Maciej?
Yeah, I mean, I think one of the very interesting point here is maybe I would just take it a bit further and say not only government, but basically insurance companies, payers, and then also see how value, which is healthcare, who benefits from increased healthcare, right, or better outcomes. We are healthier, that's fine. I mean, I feel better, but there are also insurance companies, governments that actually, again, have, either lower expense rate because they pay, fewer, they just don't need to pay their, healthcare insurance, or the governments have healthier workforce, the more taxes and so on. So again, mapping how the value, where the value accumulates, where it aggregates, and then who pays for the value. Because, for example, in some cases, and this is one of my favorite topics, prevention and interception and cure, that's very strong actually for J&J as well, but then you need to think who's going to pay for all of that. So having, again, institutions which recognize value of early diagnosis and prevention and are willing to pay for it would unlock the diagnostic field for venture capital investment.
And would that be governments to play there?
Well, governments as well, because governments basically, by setting policies and so on, can help by refocusing people on, from here to there. And then once you refocus people, then you suddenly again see, the mechanism. So you need to sort of shift a gear, shift gears and basically say, we need a new model of how the money flows through the system to enable, again, all the early prevention and interception of diseases and diagnosis, because today, the system is just not geared towards that. And again, how the money flows, it's an ocean of money, so it's really difficult to sort of redirect it in another way. But again, a country, government, here or there, may have the power to refocus people on something.
So what you're saying, and I'll let you comment, Samantha. So what you're saying, if I got it right, and for the audience, so now the governments pay for medicines, for drugs or other therapies when someone is sick, right? What you're saying is that perhaps governments should start paying for stopping people to get sick, right? Is that correct?
Or again, government and or insurance companies,
insurance
because it sort of depends on the country agreement, I guess, the system in the country. But there should be a certainly reshaping of the money streams that flow through the healthcare system, because in the current, what I call actually, we basically have a particular physics, right? There are particular forces. And we live in a particular world where these forces work. We need to change the physics. Otherwise, we will be stuck where we are today, I think. So again, by redirecting how the money flows through the system will enable, again, developing new diagnostic tools, new preventive medicine and other things. Because again, today, we're just not paid for that.
Yeah.
Great, thank you, Maciej, Samantha, and then Matt.
I think just say, and I think it's a mind shift, because you start off talking about outcomes, and I think absolutely that's where we need to go, is to focus on outcomes, and the money goes to the outcomes, so you pay for what you get. We're seeing that start to happen in the US with insurers because they see that vested interest. We're not seeing that so much here in Europe, and it is because of where the money sits as well. As you focus on a drug budget rather than the overall healthcare cost and societal costs. And if we can change that, and I think it's a dramatic shift.
Fantastic.
that will improve things in the future. But,
Matt, and then Beatriz, and I think that
Well,
will be
we're gonna get
the
kicked
last
off.
comment.
Last rounds of commentaries, and I'm going to have to rip you off.
Very good. Yeah, Matt, last comment, and then Beatriz.
Yeah, I think it goes back to partnerships. It's about getting the best minds around the table. When I speak with ministers
Okay,
of health
so
around Europe,
partnership, very good.
That
Beatriz,
was,
last
I was
comment?
in the same direction. It's,
Okay.
it's the fundamental, the partnerships where you will have somehow the public money being partnering with the private
industry
money
money.
towards
Yep, perfect.
getting the solutions.
Okay, so with that positive future outlook, I wanted to thank the panelists very much. I'm sorry if I, push it too far with the future looking, but thank you very much, and thank you to the audience as well.